Muscles that move the hip at the, or muscles that move the thigh at the hip joint are located in the lateral thigh compartment, and those are going to abduct the thigh at the hip joint. And the only muscle specifically in the lateral thigh compartment is the tensor fascia lata. And this is a short muscle that attaches to a longer band called the iliotibial tract, sometimes just referred to as the IT band, that extends from the iliac crest all the way down to the lateral condyle of the tibia. So when we look at the lateral view of the thigh, we can see the gluteus medius maximus, the tensor fascia lata, which is going to be attached to this larger region called the iliotibial tract. Other muscles that are important in this region are the sartorius muscle, the longest muscle that we have in our body, the rectus femoris, which is going to be for knee extension. We'll talk about that coming up. And then the biceps and the hamstring are the vastus lateralis, biceps femoris, and semimembranosus. Again, it's not important to know the difference between the long head and the short head of the biceps femoris. In the lower leg, we have the gastrocnemius, which is an important muscle for what's called plantar flexion. So the muscles that move the thigh at the hip joint specifically include the hamstrings, and it's important for you to know which muscles are in the hamstrings. There's three of them called the biceps femoris, semimembranosus, and semitendinosus. The functions for these muscles are shown in this table. The sartorius, which, as I mentioned, is the longest muscle, is actually going to cross at two different joints. It's going to cross at the hip joint and at the knee joint. So for that reason, it actually flexes at both joints. It's going to flex at the thigh and flex the leg at the knee joint. Also in the anterior compartment is the rectus femoris, which is going to flex the thigh and extend the leg at the knee joint. So for somebody who wants to kick a soccer ball, for example, they would be using the rectus femoris muscle, and specifically that entire muscle group, which is called the quadratus femoris group. Other muscles included on this table are the gluteal group, which is made up of three different muscles, the gluteus maximus, medius, and minimus. The gluteus maximus is going to be a very strong extensor of the thigh. It's also going to laterally rotate the thigh, and it's one of the largest muscles in the body and one that is most responsible for extending and laterally rotating the thigh. So it is the most powerful muscle in the body. The gluteus medius is going to abduct the thigh and medially rotate the thigh, which is the same function for the gluteus minimus. Muscles that are in the posterior compartment include the hamstrings, and those three muscles are the biceps femoris, semimembranosus, and semitendinosus. Notice that the biceps femoris is going to extend the thigh, and that's also the same function for the other two major muscles that are in the hamstring. Other functions that these muscles are responsible for are that the biceps femoris is going to flex the leg at the knee joint, which is also what the semimembranosus and semitendinosus do. They also will laterally rotate the leg when it's flexed at the knee. The semimembranosus is going to medially rotate the leg, as well as the semitendinosus. Muscles in the anterior compartment of the thigh are going to include the very large quadriceps femoris group. And it's called the quadriceps, as you may guess, because there are actually four different muscles in it: the rectus femoris, the vastus lateralis, vastus medialis, and vastus intermedius. So as I mentioned before, a an easy way to remember this is Rex and his three vastus sisters. So it's important for you to know the names of the four muscles that are all in this group. The quadriceps muscle are all going to converge at the quadriceps tendon, which extends to the patella as the patellar ligament. So muscles of the anterior thigh are shown on this slide. We see the tensor fascia lata, as we saw previously, extending into the iliotibial tract. On the anterior surface, we have the rectus femoris, which is the prime mover of the quadriceps group, the vastus lateralis, vastus medialis, and you actually cannot see the vastus intermedius because it would be deep to the rectus femoris. On the cadaver model, we can see the rectus femoris, the sartorius, the longest muscle in the body, as well as the vastus medialis and vastus lateralis. So for the posterior thigh, we see the gluteus medius, gluteus maximus. Can't really see the gluteus minimus, but for the hamstrings, you can see the semimembranosus, semitendinosus, and biceps femoris, which are all going to play a major role in knee flexion. So the anterior compartment, which would be shown on this slide, would be knee extension, like kicking a soccer ball. And for the posterior compartment, the hamstrings function is going to be knee flexion, sort of like when you do that movement, you are pulling your foot up towards your gluteal region. So the functions of these muscles are shown on this chart. The quadriceps femoris is the most powerful muscle in the body. The rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis, note they all have the same function, which is to extend the leg. It's only the rectus femoris, which has the additional function of flexing the thigh, just because it crosses at the hip joint, kind of like the sartorius muscle did. Other muscles in the thigh are the sartorius muscle, again, the longest muscle of the body, and it flexes the thigh at the hip joint. It also flexes the leg and medially rotates the leg when flexed. And then the hamstrings group is including the biceps femoris, semimembranosus, and semitendinosus. And remember that they all extend the thigh at the hip joint, but flex the leg at the knee joint. So as far as the anterior leg, this would be in the crural region. These muscles would include things like the fibularis longus, the gastrocnemius, which is on the posterior surface of the shin, the tibialis anterior on the anterior surface of the shin as the main ones. And on the posterior leg, we can see the gastrocnemius. And again, it's not important that you know the difference between the lateral and the medial head. Deep to the gastrocnemius is the soleus, which actually has the same function as the gastrocnemius muscle. Those functions are shown on this chart. The tibialis anterior, which is on the shin, the anterior surface of the shin, its function is to dorsiflex the foot. So that would be pointing your toes to the sky. The gastrocnemius, which is the muscle that makes up the calf, flexes the leg at the knee joint, and plantar flexes the foot. So imagine putting your pedal on the gas in the car. That would be the function of the gastrocnemius. And the muscle that's directly deep to that is the soleus, which is a synergist muscle that does the same thing as the gastrocnemius. It's also going to plantar flex the foot.